This is our case study assignment done by Alicia Ross, Jaden Woods Follett, and Lindsay Gordon. This is Milo. He is a chocolate lab. He's 13 years old, male, neutered, and he's 62 pounds and up to date on his vaccines. And Milo has been diagnosed with Demodex mites. This is our physical exam sheet. Milo's owners noticed that he had been scratching and that he was experiencing some hair loss and had itchy and red skin. When he was brought in, his appetite was normal and everything was fine, but his attitude was abnormal. He was a little bit lethargic, he was under stress and clearly uncomfortable. He had irritated and inflamed skin, hair loss on his right hind leg and under his chin and neck. His temperature was 38 degrees, heart rate 140, respiratory rate 18. Mucous membranes were pink and moist. His CRT level was 1 second, and his weight 62 pounds. And this is our procedure estimate. These are just going over the prices as far as the examination. We also did a skin scrape, and Milo was in the hospital for 24 hours, and there's an estimate on his medications. And his owner, John Brown, signed to say that all that was okay.
Next is the 24-hour treatment monitoring sheet. Milo we first started monitoring him at 7 a.m. in the morning, and the sheet goes through till 7 a.m. the next morning. His TPR was all normal, temperature normal, pulse normal, respiration was normal, mucous membranes were pink the whole time he was here, and his capillary refill time was always less than 2 seconds. We noticed with Milo when he first came in, for the first about 12 hours from 7 in the morning until 7 that night, his attitude was abnormal. He was irritable. You could tell he was uncomfortable, and he was very lethargic. And his attitude started picking up and became normal again towards the end of the night and into the next morning. Fluids, he wasn't given any, so we don't have that on the sheet. Milo urinated once at 7 a.m., once at 10 a.m., again at 3 p.m., again at 8 p.m., and again at 11 p.m., and his bowel movements were also normal. He defecated at 10 a.m., 8 p.m., and again at 2 a.m., and he was fed his normal food at the normal time, once in the morning at 7 a.m., and then once at night at 5 p.m. And we just checked off where we noticed that he was drinking water. Water was accessible like all throughout the day. And the medications that he was given were a benzoyl peroxide shampoo and a Mitaban dip. We gave him a bath with the benzoyl peroxide shampoo at 7 a.m. when he was first admitted into our care. And later on in the day at 5 p.m. we did the Mitaban dip. And diagnostics that were done was just a skin scraping when he first came in, just to determine what the problem was.
Lastly, this is a discharge instructional letter to the owner of Milo, who is John Miller, and it reads, "As you know, Milo has been looked after within our facility for his case of localized demodetic mange for the past 24 hours and is showing signs of progression on both of the affected areas, right hind leg and directly under his chin and neck. It has been deemed that Milo has become susceptible to this condition due to his senior age and a slightly weakened immune system, but has a very good prognosis. Milo is ready to return home to his family, but the treatment aspect of this case isn't quite over yet. Dr. David Summers has prescribed Milo a Mitaban dip, a formulation of Amitraz, to be applied topically every 1 to 2 weeks until the skin scrapings or visual sores no longer have live or dead mites for at least a month, and there is clear visual progress. He has also prescribed a benzoyl peroxide-based shampoo for Milo. Bathing Milo with the shampoo before the Mitaban dip applications will help the skin follicles open and effectively increase mite exposure in preparation for the dip. When applying the Mitaban dip to Milo, use a sponge or cloth and gently dab the medication on the affected areas. Cover the areas entirely. Allow the dip to air dry without the assistance of towel drying or rinsing. Be sure to wear protective clothing yourself and work in a well-ventilated area. Amitraz is mildly toxic to dogs, so take extra precaution to ensure the dip doesn't get into Milo's eyes or ears or become ingested orally. An e-collar should be placed on Milo to avoid ingesting the dip and instigating further irritation of the sores. Side effects of Amitraz may pertain to lethargy, high blood sugar, vomiting, diarrhea, unsteadiness, low heart rate, behavioral changes, etc. If any of these conditions become prominent within Milo, discontinue use immediately and bring them into us or your closest available emergency clinic. Do your absolute best to make sure Milo's daily routines are as stress-free as possible. Reducing stress can allow for more effective results in recovery from demodetic mange and help boost the immune system. Always monitor your pet's appetite and food intake, as well as urination and defecation patterns, frequency, and textures. If there are any complications where any of these areas are concerned, never hesitate to contact our clinic throughout the week. Our hours range from Monday to Friday, 8 a.m. to 8 p.m., Saturday to Sunday, 8 a.m. to 5 p.m., at the number listed above. We look forward to seeing you and Milo at Milo's next checkup visit on July 31st, 2014 at 10 a.m. Kindest regards, Jaden Woods Follett. And here are our sources. And that's our patient profile for Milo.